Hello, professionally integrated, patients, and anyone involved in a car crash. I'm going to go over a court transcript, which obviously is public record, from a deposition that a doc here in Colorado named Allison, who is typically hired by insurance companies to cut off patient care and to say that patients aren't hurt. Now, I'm going to read exactly what's on the court transcript and exactly how the question was asked of her. And I may do a little bit of, I may read it as though it's her. So, however, before we get started, I have been in court where Allison I'll call her Dr. Allison was hired by the insurance company to create doubt. The problem I have with this court deposition is not only have I gone up against her, but I have written her letters that she has read that makes her knowledgeable of the research because I gave it to her. And she says she's not aware of any in this, which I'm wondering how that's not, she's lying because I know she has it. We have court transcripts that she's been asked about it before this. So let me just read to you, and I'm going to pull up my computer because I want to read it verbatim. And I'm going to read to you the question. So this was done in a deposition. I understand that not a lot of it was allowed in court, but she says the same darn things in court. So and I'm going to use, instead of using the patient's name, I'll say Mr. Patient as opposed to his real name to protect him, even though, again, it is public record. And then I'm going to explain a little bit of why she's lying. She's either lying or she's so uneducated on this topic that she should be excused from the court to even being considered a potential expert. So if Mr. Patient, this is the question to her, if Mr. Patient had abnormalities of the curvature of his neck or the lordosis of his cervical spine, what problems, if any, would that cause over time? Now, before I read the answer, there are multiple studies from the AMA guidelines, the Journal of Spine, Journal of Spinal Biomechanics, European Spine, that show that a loss of the cervical lordosis is one connected to car crashes, leads to pain and disability, as well as increased compression onto the cervical spine, the cord, the facets, and even vascular abnormalities. That's published. Here's her answer. Actually, none. The studies have shown there's no correlation between, and I've looked into this, because there are chiropractors that promise people that they will, get a normal curve back to their spine, whether they've been in trauma or not. And then that will guarantee that any symptoms they have go away. But that's not been shown in any medical literature. There's no correlation between a specific curvature of your spine and a pain-free condition. So there's really no correlation between that. Sometimes we'll use it, for example, after an acute accident. Sometimes initial x-rays will show straightening. And that may be due to muscle spasm. Other times, patients with degenerative conditions, if it becomes so severe, they may often become kyphotic, where the angle goes backwards. So there are certain times when it, is something that may help you diagnostically, other times not. It's merely something that we look at as part of our evaluation. So I feel like if I was the attorney, I wouldn't even know what question to ask next. Because first she goes on and says that chiropractors are going to say that that's a problem and it's not in the medical literature. But as I mentioned before, that's a lie. That is a true lie that we can give her a stack of medical literature. Let's take all the chiropractic literature out. Medical literature. In fact, there's an ICD federal diagnosis code for cervical kyphosis or loss of the curve because it's a diagnosis. Okay? So one, that's a lie. Two, then she goes on and says that chiropractors will promise that if they remove it, it will take away their symptoms. And then she says there's no studies to support that. But there are studies to support that having a loss of the curve increases problems and decreases patients' quality of life. So if we improve it, the studies also show that they will get better. Then she goes on and says that, well, sometimes we do look at it because it can show some problems. So she's all over the board here. So let's go on to the next question. What are the studies, or what is the literature that you can refer me to that you say that you reviewed when you were investigating these promises made by chiropractors about restoring the curve of a cervical spine? And you said the research showed that there's actually no truth to what these people say. What is her answer? Remember, she's under oath. And she just made a pretty strong statement about what chiropractors say and what she looked into. And then she says, I can't give you any documents right now. Because she made it up. Because she doesn't have any documents to say that, even though the sentence above she said she had. Now let's look at the other question. What are the studies, or what is the literature that you can refer me to? Oh, I already said that. Sorry, my bad. Now let's look. Do you have any documents in Mr. Patient's file related to this topic? No. And I didn't look into it related to him. It was years ago when a friend's husband, who's a chiropractor, started performing that type of chiropractic. It's a certain training that they go through that includes a lot of marketing training on how to sell the people on programs. And I looked into the evidence behind it. So now she's trying to say that a true diagnosis is taught to doctors, chiropractors or whoever, from a marketing perspective. But yet she has no evidence to back that up. So one way I look at it is, man, is that considered slander? Or does she have any evidence to suggest that trying to fix a pathology that has been shown to make people worse is considered a bad thing? And remember, this is also a doc that she's talking about marketing, that markets herself to insurance companies for about $8,000 to $10,000 to do a report. So let's read a little bit more. You were asked some questions about the DMX, or digital motion x-rays, and you said that you flipped through the reports. Why did you just flip through the reports? So digital motion x-ray is video fluoroscopy. We have it here at Katz Chiropractic, and it's appropriate, accepted tool that almost every hospital has. The head radiologist of the hospital reads it. There's a billing code. In fact, the insurance company that hired her has paid for this diagnostic test. So let's see what she has to say here. They don't have any. I'm going to have trouble wording this again. Let's see. I have spoke with my colleagues in the past regarding this issue. They're not something that medical doctors rely on to make diagnoses. The measurements themselves, can't be entirely accurate. There are so many different planes of motion with these types of measurements. There's not anything that any medical doctor, of which I'm aware, relies on. Surgeons don't rely on them. Physiatrists don't rely on them. They are not used in standard medical, care. So these lines that she's talking to was established in the American Medical Association in the 5th edition. It's the only way that any doctor can actually diagnose instability, because in order to diagnose instability, they need to be measured. So she's saying that it's not accepted in the medical community. Every hospital has a diagnostic software where they measure it to determine if it's over 11 degrees of angulation or over 3.5 millimeters of translation. Now, why are those numbers important? Because that's what's been published out of White and Punjabi, out of Yale, and every other biomechanical institute on the spine of what is considered a stable or unstable spine. So how do you come up with those numbers? You measure it. So as you can see, the common theme here is either she's trying to lie, or she's just so uneducated she shouldn't even be asked these questions, but yet the insurance company is hiring her and paying her a lot of money for these types of answers. Do you really think this is what's in the patient's best interest? This is not about the patient's best interest. Let's see what else. You also said it was ridiculous to measure the vertebra segments for reduced cervical lordosis. I'm paraphrasing. Other than the word ridiculous. Answer. Yes. Why? Question. Why did you say that? Well, it's It's going back to this DMX, which when I hear that, I mean, it's not real medicine. It's, a chiropractic driven something. It's something they do to generate some income. And then they come up with these findings and do all these measurements that don't mean anything. It's a useless exam. And nobody relies on it. And obviously I'm not measuring. I can't see the spinal segments on a physical exam. So Dr. Allison Fall, who is hired by the insurance company and makes a ton of money by marketing herself, is trying to say that doctors like me that have to follow guidelines when she doesn't, has to file ethical guides which she doesn't, because she's hired to give an opinion. When you come to me as a patient, I have an ethical and legal obligation to do everything that's appropriate. For her to say that the digital motion x-ray and these line drawings are chiropractic is totally crazy. And again, it's either a blatant lie or she has ignored everything that's been given to her and has ignored what's appropriate in the healthcare community. So if you are a patient and you are suffering from a car crash, you're going to get sent to an IME, or what's called an independent medical evaluation, even though it's not independent. It's really an insurance medical evaluation. And they're going to pay a lot of money for you to see a doctor like this that really doesn't know what the hell it is that they're talking about. So I hope that, I know some might find this funny because of the ridiculous answers that were given, and others may find it completely sad because they were the ones that were injured and now they were dragged through the mud by somebody like this. So the question I have, if this ever makes it to Dr. Allison Fall, is I want you to go look in the mirror and I want you to ask yourself how you're unaware of any evidence or science or research about the loss of curve, line drawings, or AMA when I have given this to you. So either you didn't read it, but I know you were asked about it in court, and now you say you know nothing about it. This to me smells fishy. So, or how about this, Dr. Fall? If you're really here for patient care, which I am, let's meet. Let's do a live webinar that patients can decide what's best for them. I want you to educate me, and I'm going to try to educate you. But if you're not ready or up to the task, you should probably start explaining to patients when they walk in your door why you're doing what you're doing. But I'm ready to sit down on a live web feed for you to explain to me what you said here in this public record, in this court document, and then let me answer these questions and see if you really want to know. And if you do, it's going to change how you approach patients, and you can make a greater impact on public health than by treating these patients and understanding the science. If not, and you don't want to know, well, you made your decision. I hope that you do, and I look forward to hearing from you, which I'm sure I won't, but I hope I do.